Hello, welcome everybody. Thank you for joining us. We're going to give it a couple of minutes to have people join up. In the meantime, just a couple of quick notes. Feel free to have your camera on, but please keep your mic turned off until the breakout room sessions. Chat is enabled, so if you want to let us know who you are, what organization you're with, and something you're excited about, could be data related, or perhaps a little bit more relevant for today. You can let us know how you're surviving the heat. I, for example, want to dunk my head in the tub, but won't do that until after this meeting. So just can we access the chats? And I do apologize for all the messages of all the AI bots that are going to be popping up. See any messages? I suppose we should have tested the chat before we started. Perfect. There we go. Wonderful. All right. So we're going to slowly get started with the housekeeping notes. So my name is Amit Kohli, and I am Head of Data Insights at Access Social Care. For those of you that don't know who we are a charity, and we effectively help people with social care in two ways. We provide direct assistance to individuals with caseworkers, and also we use technology. So we have a digital product that we can use. Some would call it a chatbot to try to get people assistance. And then the other branch of what we do is much more system change oriented, where we have several campaigns trying to understand how to change the system. So things about how to challenge central government, how to ensure that the education system makes sure that there are people that understand social care law in the future. And then the third element of this is data. So how can we use data and understand a little bit more about what the system is, what are the good places to push, et cetera, et cetera. Really excited. This is the inaugural session for the Joining the Dots event series. Really exciting. We have another one planned after that, we will see. But effectively, the things to say are, a lot of people talk about how there's no data in social care. And I think that's a caveated thing, right? So, for example, we do know that without knowing about unmet need, it's a little bit difficult to kind of make an assessment of the sector in general. But we've also heard that there's too much data, and it's difficult to triangulate that information, kind of figure out what all the data that is being currently reported, what does it actually say? How can we use that? So I think that's what this session is about, really, just to create a gathering place where we can, all of us, put our heads together and say, is it too little data, too much data? What's missing? What do we have too much of, et cetera, et cetera. This event is made possible through our collaboration with Joseph Rowntree Foundation. Rosario, I don't know if you're there, but if you are, you can virtually stand up and take a tiny bow. And I think that's all the housekeeping that I wanted to say. Yep, for those of you that are just joining us now, you feel free to put your cameras on, but mics off, please, until the breakout session. The session is being recorded. I hope that is not a problem for anybody. If it is, then we will understand. And yes, I think we can just, with that, we can more or less just get started 1 minute early. I'm sure that we'll use up all the time. So let's get started with our first presentation of the day. They're going to be 10-minute presentations, after which we can have a 15-minute session to kind of gather up all the thoughts, and then we're going to do a quick little wrap up at the end. But our first presentation is going to be by Ed, who has joined CPEC as a research officer in 2021, works across multiple projects focused on health and social care, especially using qualitative methods. Ben is going to be talking to us about the social care data catalog project that they were working on. Off to you, Ed. You have 10 minutes.
Thank you. 1 minute. So basically what we did, so essentially I'm a researcher from LSE, and we've got a centre joined onto LSE called the Care Policy and Evaluation Centre. So we do lots of research to do with lots of long-term care, social care, and also healthcare kind of research. One thing we wanted to do, and I'll try and just share some slides now. Would everyone be able to let me know? I'm just checking that if I go full screen, that everyone can still see the slides and see them
Yep,
change.
looking good.
Yeah.
Okay, great. So basically, what we did was we put together a social care catalogue, and what we were basically doing is collecting together measures from kind of questionnaires or data collection templates to do with receiving social care, needing social care, or providing social care. So any measure to do with any of those three things: receiving it, needing it, or providing it. Um, and so there were kind of four main objectives why we did this. We wanted existing social care data to be found in one place and people to use it a lot more and find it a lot more easy to use in one place than they do at the moment. We were hoping also that then people could notice research gaps and notice where there was actually gaps in social care data, and then of course kind of want to fill those gaps as an objective. We also wanted harmonisation to occur. So we thought if people can see what other measures about social care are being collected from all these longitudinal UK data sets and these council data collections, etc., then maybe people would start asking measures that could be harmonised together and actually become more comparable between data sets. And finally, we wanted to encourage other researchers, maybe people who do research in fields related to social care or quite different fields, to actually be able to use social care data. And we thought those four things together would improve the uses and the social care data landscape. And what we do is we provide links to the data sources eventually. So we show you what measures exist on the questionnaires or the data collection templates, or wherever we can find measures to do with social care. And then we just provide a link to the data source. We ourselves do not provide the data itself. I mean, I've kind of spoken a little bit about this already, but what do? We give lists of the measures. We have large national and some regional data sets from particular parts of the country, but we aim to have, at the moment, fairly large data sets. People have before have asked, well, how large? We haven't got an exact cutoff, but we try and have a kind of substantial, many thousands of participants usually. And then we have lots of different ways of searching inside the data sets. And then we give accompanying data. So of course you can look at related measures. For each data set, you might be able to be like, okay, there were social care questions in this data set, but there are also measures related to quality of life, mental health, healthcare, employment. And so we show what other types of measures each data set has. Because of course these can be merged with social care related data measures. We give some background information about when the data set started, and we allow whatever measures you kind of find from your searches, you can download them in a few different formats, including Excels, things like that. And then the main thing we don't do is provide the actual data. So of course we give a link and then people have to go away and obtain the data themselves. That's not something we were able to do, sadly. I think those are all the important points on that slide, to be honest. Oh yeah, and also we're not international yet. We have not collected any measures from datasets outside of the UK. We're hoping we've got some more funding, and we hope to expand our datasets and hopefully have more datasets from Wales, Scotland, and Northern Ireland, and look at more marginalised groups in society and try and include more datasets that have measures to do with them. So yeah, these are some of our future plans. Expand it. We're going to do some user research as well, make the data set, make the catalog more user friendly, and see how people want to search for measures. And yeah, those are basically the main things. I guess the other main thing, which of course, like I'm speaking today, is we want more people to know about the catalog, because we've set it up and it's been live on the internet for about a year and a half. And to be honest, I don't think we've quite got the usership that we were hoping we'd get yet. I realised already, how long do I have? About 5 more minutes. I thought what might be interesting would be to just share a web page and try and just show everybody. If I go back to Teams for a second and just show everyone kind of what it looks like and how we would normally carry out a search. Hold on, I'm just trying to do that thing, stop sharing. So I'm just going to share a second screen with everyone. One sec. So hopefully now people can see. Um,
Looking good.
Yep, looking good. Great. So I'll click on all measures. So basically, there's a few different ways to search the catalog, and we've got a few videos to show in more detail. But what we have, the two main ones, if you click on search at the top, is you can search dataset by dataset, or you can search all measures. So what we have here is a list of 3,215 measures, and these are all the ones we've collected so far. Hopefully, in a few months' time, we might have another few thousand measures, because with this new funding, we want to carry on and do a lot more and catalog a lot more data sets. So I'm just going to give you an example. We have this thing called the custom search builder, where you can basically start to run a search and kind of filter for different things. So for example, I'm going to try and show you how you look for stuff about how much caring unpaid carers do, or young unpaid carers do, each week. So this is just something I thought of earlier, where firstly, we'll put what type of data we're looking for. We're going to have it equaling, and then we're going to have provision. So I hope everyone can see right here that we've got need provisional receipt equals provision. We've gone for measures about providing. Next, I can put in an age range. So this is where you can basically look inside an age range. So this function here, I'm going to go find in a range, and whatever we've got many different data sets, but I want questions which would be asked, might be other ages as well, but will be asked to a 14-year-old, which would be a kind of young carer type situation. And then I'm going to search for questions. So in the wording, so of course, when we collect these measures, we put in the exact wording of a question. So I want questions or data items that contain, so I click contain there, the word care. So we're at the moment, we're on provision categories. We're asking 14-year-olds any question to do with care. And then finally, we could add one thing, is we want the responses. So of course, for every question, it might say, how many times a week do you provide care? Because that's the question, and I've put in that care keyword, it's going to find all the questions on all the data sets that talk about care in the question. And then in possible responses, I'm going to be looking for responses that contain the phrase, what did I decide on, per week? So now we've gone from 3,215 entries, and we've got down to 5 entries. So I think hopefully you can see here there's a list, and they seem to be from 2 data sets. So I think this is the school census and FRS. I'll just open it in a new tab so I can check. Oh, it's a family resources survey. So some of these measures are from the family resources survey, and some of them are from the survey of carers and households. It wasn't the school census. So 2 data sets have those questions. If I click the plus, you can then see. So this one, which is a good one, let's go for the first one. So this one was asked to adult informal carers, but some of the sample size, because it's from 0 to 120, might involve young carers. And then some of the responses here you've got are the amount of hours each week that someone does their caring. So essentially what you do is you can scroll through this big list of measures and open them up, and it will show you, firstly, I hope everyone can see here, it will show you the question wording, and then underneath it will show you the responses that were allowed for this question. So that's just one example where, imagine I was interested in how many hours per week or how much per week a young person cares. I believe I've got just about 1 more minute to go, so I'll finish there. I hope that was just, and we can discuss it more, I guess, later, but this is just a brief overview of what we did. We tried to list lots of different measures to do with social care, put them in one place to encourage people to be able to see them in one place, spot gaps, encourage harmonisation, and just be able to find out what data exists relevant to social care in any field. And this has brought in data sets from all over the UK, all sorts of different types of UK data sets into one place to try and make it easier, because of course social care data is there, but it's incredibly spread out at the moment. So this was our attempt to bring it all back into one place where you can see what data exists. But of course, unfortunately, we can't offer the data access and for people to be able to access that data. I think that takes me to about 10 minutes from my presentation, Emmett.
Outstanding, and thank you for being punctual, and of course for demonstrating your wonderful interface.
No problem.
Really, really full of possibilities, and a wonderful way to kick us off, because I think you kind of addressed this concept of trying to, first of all, answer the question, what data is there? And I think you have very competently done that. In the interest of time, I forgot to mention, we're not going to have time for Q&A, but do please feel free to put questions and reflections in the chat, and we can kind of answer as we go, and anything that gets unanswered will wash up in an email afterwards. But for now, just in the interest of time, let's move on with our second panelist, Carrie. She is our CEO, our fearless leader. She's also a social entrepreneur, an experienced executive, and a strategic thinker with proven experience of driving growth. Carrie's going to mention the experience of Access Social Care in Gloucestershire and more or less what we have done to try to extrapolate that success elsewhere. Carrie, it's you.
Thanks, Amit, and hello, everybody. Thanks for joining the webinar today. So I want to tell you a little bit about what we've been doing in Gloucestershire and how we have tried to scale that work. So back in 2021, we started working in Gloucestershire, and our hypothesis was that by working with communities, we could improve social care outcomes for individuals, but also start to make changes to policy and practice on a local system level. So we initially started delivering legal outreach to help people understand what their rights were and to build confidence amongst communities to use legal language to improve their outcomes when they were asking for social care, for their social care needs to be met. Through that legal outreach, we started gathering data, qualitative data, about the types of issues that people were experiencing. We also started to encourage local people to use our online service, Access Ava. And Access Ava is an online legal information service, and behind the legal information provision, it captures data about the themes that of issues that people are experiencing when it comes to accessing social care. So through this, the qualitative and the quantitative data, we started to see themes. We could see that local people in Gloucestershire were experiencing problems with assessments, problems with charging, issues with continuing healthcare, and also issues with respite. We then ran clusters of legal cases around those issues, and that helped us understand the root cause of some of the problems that people were experiencing. And that was really interesting because actually what we could see was what a problem that was presenting as a respite problem was actually a problem with assessments. A problem that was presenting as a charging problem was actually a problem with information provision from the council. Oh, I don't know if it's possible for people to just put themselves on mute because there's a bit of background noise. Thank you very much. So we then started taking that data to the local authority, and over time we built up a really positive relationship with the local officers within Gloucestershire Council, and they started taking our data and using that data for quality improvement. So one example is that we took data around charging and people's experiences of charging, and we could evidence that some people who are on the higher end of need, usually in receipt of the higher rate of PIP, were choosing not to have social care because they felt that they couldn't afford it, and they were in fact choosing between feeding themselves, heating their home, and paying for social care. When we took that information and that data to the local authority, they decided to change their charging policy. And now in Gloucestershire, if you're on the higher rate of PIP, you have about £30 a week back in your pocket, and your the way that you're charged for social care has changed completely. Similarly, we've identified at the moment there are some issues with safeguarding and the way that safeguarding queries are being handled. We've taken that data to the local authority, and the local authority have started now to do an investigation into what's happening with safeguarding queries within Gloucestershire. So we're really delighted with all of this, but it's taken a lot of intensive work from our team in Gloucestershire to gather that data and to present it back to the local authority. So we started to have a think about how could we start to scale this work, and that's where the data portal comes in and the work that Joseph Rowntree have funded and that Amit within our team has led. So I'm just going to share my screen for a moment. Hopefully you can now see the Access Social Care data portal page. So this is very much a minimum viable product. Amit gathered lots of data from lots of different people to find out what people wanted to see on this live data portal. Essentially, our aim was to gather data from lots of different sources and to start to group that data by local authority. So I'm just going to move you all over on my screen. Hopefully you can see this. So we've started collecting data on a national level, and we've created data. We've taken data from lots of different sources. So you can see that we're taking NHS data, Ombudsman data, Skills for Care data about workforce. We've got data that we've been collecting from our own casework and advice provision, and we also lead a national advice sector project where we're combining data from lots of different sources. And in fact, there's a webinar. We issue a State of the Nation report every year, and this year our State of the Nation report webinar is on Wednesday if anybody wants to sign up for it, and you can hear all about what we found out from that data. So we've started to put all of that data together to combine it, to start to build a picture about what is happening in each local authority. So if I just jump now to the social care by local authority, you can see here, if we click on Gloucestershire, we're starting to put all of the data in, and we're using AI to create these short summaries. We're inviting people to share their own stories about what is happening in Gloucestershire to help us to try to interpret this data. Now, we're very much at a starting point. We know that we need to work on the user experience. We've had lots of great feedback from people who are starting to use this data portal to find out about what's happening in their local area. Now, on this page, you can see we've got a summary about what's happening in Gloucestershire. Again, this is being calculated using AI, and we've got some summary information, some an overview of what's happening in Gloucestershire. We've got some charts on the left-hand side. We're using AI on the right-hand side to explain what the charts mean. Amit has been very conscious to use simple language, so the AI has been programmed to be as accessible as possible with the language that it's using. We're inviting people to feed back on what the AI is telling us. So you can see here, people are invited to click on the tick or the cross to say that they agree with what the AI is telling us. And that might prompt us to then look and go in and check if there are any concerns being raised about what the AI is saying. You can then see that we're ordering data by different categories. So people who draw on social care, you can see here in Gloucestershire, I'm really delighted to be able to show you this little chart here. So this is from our helplines data platform. Previously in Gloucestershire, so the blue line is the national England figures around people contacting helplines for assistance. And you can see that across the country, the England average is for charging to be one of the highest issues that helplines are contacted about. But in Gloucestershire, it's one of the lowest. And that's because we've done lots of work in Gloucestershire around charging. And so we're really pleased that that's dropped down. You can see that, as I just said, we've identified that there's a bit of an issue with safeguarding, and Gloucestershire Local Authority are now doing a little bit of research to look into why we're seeing that spike around safeguarding. Similarly, we've got information about carers, around care providers, around quality, and also around finances. So you can find out how much your local authority is spending on social care per head in your local authority area, and you can share information, as I've said, about your experiences of social care, and that helps us interpret some of the information that we're seeing. So we've put in case studies here, you can see about people's experiences. I'm going to stop because I'm aware that that was 10 minutes. Really happy to take questions in the chat if that would be helpful.
Thank you very much, Carrie, and thank you for not making me bash my gavel. I think this is a really wonderful, yeah, well, I mean, a little bit of vested interest here, but I think it's an interesting way of demonstrating the power that you can have when we start combining information. So up next, we have Victoria, who has a solid reputation working across social care and healthcare organizations to provide solutions to the sector. And I'm never going to use AI to produce bios ever again. This is terrible, and I do apologize for that.
It was quite good, though. It was sort of all-inclusive. It probably does say what I do on the tin.
So Victoria's going to be talking to us about the geospatial portal that they built over at ARC. Take it away, Victoria.
Thank you so much. Yes, Amit, I do have several hats, and today I'm being more than one of those. So as well as showing you a little bit of ARC's Polymapper tool, which I'm delighted to say that we are working towards with our colleagues at Axo Social Care, integrating into their data portal, because data has real power. Working across different agencies within health and within social care, you realise that data insights, as Ed has talked about, as Carrie's talked about, can really unlock great care and the care experience for people within communities, and improve commissioning through local authorities and ICBs, and actually enhance overall how we think about care in communities. We didn't go through a transformation and digitisation process, along with many others, in 2008. Social care was the poor relation to the NHS, and it always has been. So what you're actually seeing today is there is a real amount of data out there, and what's happened within policy perspectives and within central government is they've made it complicated. What we really are starting to do today is talk to you about democratizing data, making it open access, making APIs that work for people, making interoperability and transparency and candor, because that's central to social care. And a lot of what we do is think about the shared care record, the clinical record in the sense of self. But as Carrie started to explain, and I'm sure Ed's information shows, we also work with Mike Clark at the LSE on the mental health impact and catalogue as well. So we've had lots of opportunities to have those information discussions about research. And the fact that social care is now getting people interested in researching about it shows that it's changing, and we're getting more capable at doing more with our data. And we really want to see the whole picture of people, which is why I'm going to take you through a few different things that we've been doing. And hopefully I get rid of Teams. You can see our fee rate dashboard.
Yep.
Yes. So at ARC England, we are passionate about learning disability and autism services. We represent about 100 care providers around the country who are ginormous in size to tiny grassroots organisations. And that's a theme for us, because we've never really given an opportunity for you, whether you're a tiny operator or a big one, to have access to data. So our research unit at ARC England created this fee rates disabilities map. You're looking at our latest iteration version because local government publishes a year in arrears. But essentially, you can find out all sorts of information from us about this. It's publicly available, and I'll drop the links in the chat after I stop talking. We've made it searchable by local authority, which is like the data configuration Amit and Carrie have done with their data portal. But you can also search by constituency level, because we're really interested to influence who else around your local cabinet can help change the messaging for social care. So I'm just going to jump into, I'm going to do my own. Altrincham Sale West is where I am today. Amit, you're up next. You'll tell me which local authority or ICB in a minute. So you can jump in here and we'll just give you free rate information about what it is for residential services in that locality and how it also stacks up against those that are seen around the country. So the data that's in the top is the local authority level fee rate information. And what we've also collected is 7 years of this data. So we now have a longitudinal study, which you can access the rest of the information. Tells you who your MP is. And we also do letter templates. So you can write to your MPs about things that are going on. Really brilliant opportunity to get more enriched data. And we've done the exact same thing with ICB level. So you're going to start seeing more of that data coming for us. In addition, I work for another organisation that looks after parts of the social care sector that are attuned to mental health service care and provision. And here we've taken a data extract from CQC, as well as our own membership information, local authorities and non-members of the Association of Mental Health Providers. And you can dig into this and start to understand where mental health VCSE service provision is. Amit, tell me what location you're in. What integrated care board are you? London somewhere, I presume?
Lambeth.
Lambeth. Your ICB is probably bigger than that. So where's Lambeth? Tell me where Lambeth is.
Southwest.
East. There we go.
Southwest London.
The geography is never my special point. That's why I have a map that does it all for me.
Lovely.
It helps us take those IMD scores, those population indices that you also see in your data tool, but it tells us what CQC provision there is, what unregistered provision there is. So you really start to get a whole picture. This is SLAM, South London and Maudsley, so lots of people would know that. Here's a local authority in our little green. Ooh, Specialist Health Team for Learning Disabilities. So another great publicly available access and resource. And Ed was talking about unpaid carers. There is a great unpaid carers dashboard recently produced by Sheffield University. Brilliant tool. But in mental health world, we started to look at that ONS and that census information data. And here we've taken skills for care information, one of the great data sets around social care workforce, and restructured it to look particularly at mental health, social care within community. And I thought it was fantastic that Ed talked about unpaid carers, because in our layers in this map, we have so many different things that you can pull from the census. So gender identity, sexual orientation, religion, ethnicity. And I toggled on people providing the unpaid care hours so you could have a look at this. And it gives you a legend to, I don't want to move that, make it all pink. Go back. Let me see. You can see that the darker the denotion is there, you can see the count of people providing unpaid care at structured level. So Ed was talking about 19 hours or less a week, 20 to 49 hours and so on. If I switch off our workforce overlay, so you can't see that, you can now see the mapping of the unpaid carers and the greatest level of density area as well, interestingly, is kind of touching Southeast London region as well. So some really fascinating tools. I was also going to just talk to you briefly about local authorities. Local authorities now have to, by law, publish lots of information about their health and social care data. So I'm showing you Richmond because I knew we were going to have some London themes today. And here, huge amounts of information about the percentage by population age, life expectancy, broad trends. So again, some of the visualization tools and techniques that you can really use for different data sets. The data's everywhere. And I was just coming back to you to talk about how we bring that together, how we make the lived experience interesting and improve lives and improve outcomes from the data we have is the most important part. We can pour it all into the top of the funnel and we can create lots of different visualization tools, catalogs of information, data sets that we can apply and correct and overlay, but more importantly, they have to have purpose, and the human element has to be the center of our thinking about this data. So let's hopefully go back to democratizing some more of it, sharing it, and not being so closed about the care and support that we think is important for people, and how we can achieve that by working collectively together with the data we have.
Wonderful, Victoria. Thank you very much. I mean, it's always good when you introduced one person to speak about one good topic and they introduced 3, 4 for the price of one. So thanks very much for that, Victoria. And I think that's a really wonderful segue to send us off into our breakout sessions. So here you've seen kind of 3 very brief presentations in which we're trying to map out the universe of social care data. You saw the Access Social Care approach, where we're taking a very kind of limited and structured look and then using AI to say, what does that say about an area? And then Victoria demonstrated several kind of data-rich dashboards. So I think, you know, kind of within this kind of universe, we thought that we could have 3 breakout rooms, one in which we're talking about what can be done about kind of resolving the challenges that we have today with data. What could tools like these ones that are presented do to solve the existing problems in the sector? And then just in general, what ideas were sparked? So we're not going to send anybody into any groups, but I'm going to open the rooms now and feel free to jump in. I think we can, or I think, Sean, have you opened the rooms already?
No.
Yeah, I'm going to take over and I'm going to open the rooms. So hopefully you should see that the rooms are opened now. There's going to be one of the presenters in each room. Carrie's going to be in the challenge room, and Ed is going to be in the tools room, and Victoria's going to be in the ideas room. Please feel free to join up. We're going to come back at 2:50, so we have just under 15 minutes there. And yeah, just to mention, we're going to have someone report back. So please nominate someone in the group. It can be one of the presenters, but please do volunteer, and make sure to not use the chat in the breakout room because it's ephemeral. And when we close the rooms, it's going to go away. I'm going to be quiet now. Please go into the rooms. And if you need any assistance, I'll be here. And for the people that remain here in this room, I suppose we can also have a kind of an ad hoc session, but do feel free to jump into the rooms if you can. If anyone's experiencing any problems, feel free to unmute yourself for additional guidance as well. No worries.
Amit, can I say I can't actually see how I join a room?
There should be a little display at the top of the meeting where, do you see that it says rooms? Or you might see it perhaps on the right panel of your chat window.
No.
Okay.
No.
Do you see rooms at the top of your?
No, I've got chat, people, raise hands, react, view, more. Let's see if there's more. No.
Interesting. Would you like me to assign you to a room?
Yeah, I mean, if I could go into Carrie's room, that would be good.
You would like to be sent to Carrie's room already. Let me see if I can right click and I can. I can no, no, I can do that. I cannot force someone.
Right.
I think
join.
because we've
I'm also
selected.
unable to join any rooms.
You are not allowed to join any rooms?
No, it won't let me in.
I see. Well, I tell you what, let's make this in the room number 4.
Yeah, the impromptu room number 4, yes.
Anyway, as long as Hugh is here, then this is going to be the best room no matter what.
Well, that's very kind of you. I haven't attended any of these. Was this the first one, or?
This is the first one, yeah.
It's the first one. Yeah. Yeah, I'm keen to join though. Yeah, it's good to see what you've been up to, Amit. It's been a while since we met. Yeah.
Yeah. And if you attend the session tomorrow, you'll see the other thing that I've been doing that has taken up more of my time.
Awesome. I'll make sure to join that. Yeah.
But yeah, so what's your so both of you having seen, these two things, what reflections are coming up?
Yeah.
Sorry, after you.
No. You first, Colin. I'm sure you've got to say is more important.
Oh, I don't. Oh no, I don't suppose that for a second. My focus is fairly narrow. I mean, I'm a huge believer in data, and I think you can tell so many true stories with data, especially in a service which is so driven by hubris. There's an awful lot of nonsense that's got to be cut through.
Yeah.
But there is, the reason I wanted to join Carrie's room is that one issue that we've got a shared interest in is unmet need, and the extent of unmet need, and what thoughts you have got about data that could support, or data that's required that's not available, that could support an understanding of the scale of unmet need. Because what we've got at the moment is speculative stuff from Age UK and from the think tanks. It's never had any impact on politicians, and frankly, it's not. It probably shouldn't anyway, because it is highly speculative. It's not rooted in any kind of credible data. So that was really the question that I had for Carrie. But I can put it to yourselves equally. What information what data do you think is available now? What data do you think should be available?
So I can answer that, but I don't know if Hugh, you want to intervene real quick, and then I can.
No, you go ahead. Go ahead.
So I have two ideas about that. Number one, in the data portal that we created, we are allowing people to just to talk about their stories, and I think we can start, if nothing else, with the case study. So we want, just like what Carrie said, we want to understand what each local authority believes their service is, the lived experience of their service, and then effectively provide counterpoints from the community to say, you think your assessments are accessible to the Bangladeshi community. Well, here we have 3 examples where it's not. Is there anything that we can do in a small group to improve this one small thing? So not push in a large kind of national way, but to solve many small problems, and in so doing, perhaps kind of break things down. But the other bigger idea that I have is I think we need to ground truth the statistics that we have against census, against other countries, and effectively just make population level assertions about, we know that we can expect 10% of the population to experience this problem. And, supporting ourselves with specialist organizations, we can say we can expect 20% of this community to experience a problem that legally falls under the purview of the CARE Act. So I can expect, within an order of magnitude, that the number of people in this local authority that have this exact problem is going to be 27,000. Plus or minus, a large margin, but use that to ground truth the information that we are getting. And at very least, I think what that will do is more or less pass the litmus test of saying this number is completely off, or it looks like we're doing a pretty good job at hitting this. But this is all highly speculative, and of course, where's the money for it, right?
Well, there are a couple of problems with it, Amit. I mean, in a sense, it's not actually any different from what's been going on for the past 20, 30 years, because the problem is that all projections of unmet need are instantly undermined by local authorities saying that they are meeting all needs under the CARE Act. That's the problem. It's a foot shooting behaviour, because in one moment they're saying we are in crisis with the level of funding that we've got, and we can't do everything that we want to do. But then in the same breath, or the next breath, they are saying we're able to meet all needs under the CARE Act. And so that means that the civil servants, when they speak to the politicians about funding levels, they say, well, actually, councils have got all the money that's required under the Care Act. So it's instantly undermined. So I mean, I agree with you that the work, the kind of the anecdotal information that a good advice service can generate, of course, that should continue. But in itself, I can't see any reason to believe that it will have the impact that's required in terms of creating a data set that the Secretary of State can believe actually represents the funding gap and the scale of unmet need, because that's what it's going to require. It's similar to the NHS waiting lists. I know at the LGA ADAS are talking about waiting lists now, but they're waiting lists for assessments. They're different from waiting lists in the NHS. In the NHS, you're on a waiting list if you've been diagnosed and assessed and are waiting for the treatment. It's a clear message to the politicians. You need to put more money in to reduce the waiting lists. The waiting list in social care is for assessment. Following assessment, ADAS say all needs are always met. We know they're not, but that's what they say. So that's the problem. So I wondered what Carrie's view of that actually is. I mean, I have shared with her some work that we're doing on the changes that are required systemically to generate, so the system generates that data. But I'm waiting to hear back from her on what she thinks. But today wouldn't be the right time to put her under that kind of pressure. But at some point, I will want to know if she thinks that the proposal that we've put forward is one that she would want to support.
Well, please do come to our session tomorrow, Colin, because tomorrow's session we will be looking a little bit more at the system change side. So this is much more on just specifically on data. But tomorrow's session will cover 1 year of Labour government. What has that done for the sector?
Is it tomorrow or Wednesday, Amit? Are you talking about the state of social care?
Yeah.
Oh, that's Wednesday, I think.
Is it Wednesday?
I think it is. Am I wrong?
Could you provide a link? Actually,
it is on Wednesday.
Could you provide a link? I don't have that. I've somehow lost the meeting chat.
I'm hoping to get there, Amit, but I'm not sure I'll be able to actually.
Thanks, Sean.
I hope that I sent the right one.
Well, I've got it for Wednesday.
Sorry, I have that's correct. It is Wednesday. What I have tomorrow is a prep.
Right. Okay. That's an internal thing for yourselves.
That's correct. Yeah. Thank God. But I think the session that I sent on the general chat is the external one. So.
Okay.
Whew, thank God. That'd be really awkward if I invite 50 people to the internal session.
Anyway, that's my thing, Amit. That's my issue.
What organisation are you from, actually, Colin?
Well, I work with we're called Campaign for Real Care. We're a small outfit.
Okay,
but,
sure.
Actually, Access Social Care does actually, we're independent. Access Social Care does actually, they've actually signed up to support us, but we need to work through some of the detail.
Sure.
Because some of it is contentious.
I mean, what I would say on this issue is that if you're looking for data on unmet legal need, it's a sort of difficult thing to measure, because you're looking at it's like saying right, so I've got a light detector, where are the shadows? It's that sort of idea.
Right.
You sort of there's a few different shapes that an unmet care need could take. One is the person just doesn't know that there's any provision out there and doesn't look for it. And
True.
I don't think you're ever going to detect that. What you could detect are places where they start the process somehow and don't get any further, places where they get an assessment and then for whatever reason decline the care that's being offered because it's not appropriate for them, and I would say maybe maybe a few other things like that. But the people that just don't know about social care, you're not going to manage to
No,
detect
that's
them
true.
very
That's
easily at
true.
all. Yeah,
That's true, Hugh.
that's my take on it.
But the other group, of course, or two groups, are people that the system knows but turn away.
Yeah,
because they're considered not to have eligible needs, and those
sure.
that do get
Yeah.
an assessment, they get a wrong assessment that doesn't identify all of their needs. You know, it's restricted by money, finance.
All right, gentlemen, I'm gonna have to bring people back now.
Right.
Okay, sure.
Sorry,
I'll mute.
apologies.
Thank you.
Hopefully everybody is back. How does this work? Do I have to reauthorize everybody? Admit all.
I think we just got all come back.
Yeah. That's interesting. So I close the room and then it kicks you back to the lobby. Sorry, I'll work this bit out. Sorry, very interested in the tool. All right, well, I hope that those meetings were, those sessions were refreshing. Let's hear from Carrie's group. Who's your nominated rapporteur? You'll have 2 minutes to tell us what you guys got up to into the challenge room.
It's me, I'm afraid. So more of my voice. So I'll kick off. So we had a little bit of a chat around one of the challenges being, how do you present the data to two different audiences? So if you're presenting data to communities and for people who draw on social care or carers versus decision makers in councils, how do you lead people on that journey and make sure that the user experience is right for them? So that was one of the challenges. We chatted a little bit about some of the solutions. And being careful to simplify but not oversimplify so that you don't lose the nuance, but also drawing people in and encouraging people to share stories will be a really big thing for us at Access Social Care. So we're likely to have two different ways in for different audiences, if you like. Vijay in our group raised a really important point around there being issues with data categorization within social care. So when you're comparing data from two different local authorities, there are issues around, are we comparing like for like data? Is it apples as apples, or are you comparing an apple with an orange? I thought that was a really interesting point that Vijay made, and he said that he thinks that it's about a 3-year project to try to really clarify some of that, bringing everybody online so that when we're talking about things, we're all talking about the same thing. There was some anxiety around the use of AI to classify data, but other people in our group saying, well, but people want that. And people are starting to ask for AI interpreting the data. There was some discussion around the need for having a human in the loop and to train that AI really well to really make sure that it's giving you quality analysis. John in our group raised the issue, and this is something that's come up for us, and we'll talk about it in our State of the Nation report that's coming out later this week. The goalposts keep changing, so the data that's being gathered year on year keeps on changing, and that makes it very, very hard to track what's happening to social care because the data is not, you can't compare it year on year. There's a real need for that kind of changing to stop, so that we can really see what's happening with social care. And then the last point was that there's a real need to support provider organisations to learn data literacy so that people can engage with some of the data that's out there. Hopefully I've done justice to everything that was being discussed.
Wonderful, Carrie. Thank you very much. All right, what about the tools room? I believe that was you, Ed, or your person?
Yeah, I'm happy to summarize kind of what we talked about. I think the most interesting thing for me from our discussions was this fact that how can you still, well, basically we develop these tools, but when you actually want to monitor, like on the ground level, say there's an interaction or something changes in the way a local authority does something, or a particular provider, or any sort of innovation, I think despite these tools, it might still be very hard to be able to kind of track exactly what's going on. And we did talk about innovation, the fact that this is getting a lot better, But I think one of the interesting things from our group was, yeah, like how do you actually monitor the changes, interventions, and on a very local level? Because maybe we're getting much better at summarizing the data, etc. But when is it still a requirement that you need to do some very specific research, with a very specific research plan in one particular area to unpick what's going on? We also thought a lot in terms of some of the challenges. There was, I guess, a bit of hope voiced and some excitement. I think Owen was talking a bit about this, is the fact that actually, yeah, the better linkage and kind of merging of NHS and social care data and records is becoming more and more possible, which opens up other avenues to kind of track health markers, population health, and what's going on. That was very interesting. We talked a bit, I mean, also about awareness and the fact that actually, just from attending today, one of the challenges is, of course, awareness of what social care data exists, and that actually having these types of discussions and having these catalogues will make it easier for advocacy groups, policymakers, all sorts of different stakeholders to be able to understand what data is out there, which of course sparks ideas for research or for projects or for advocacy work, etc. So I guess we talked more about the problems than how how could tools like this solve them. But I think what we'd already talked about a bit together and in the group was that actually, yeah, there's lots of different ways that they can help solve them, and lots of the functions we've already discussed, I guess. So yeah, that's the summary from our group.
Wonderful, thanks, Ed. Victoria, your group.
Yes, and me feeding back as well. So similar lines, we were a little bit more solution focused though. So in the ideas room, we were really interested to think about what's the qualitative data that we also need to collect in addition to some of the more traditional data sets that are already there, and some great creative methods such as storytelling and drawing, using Minecraft as a digital tool to collect information from people themselves. I mean, it was just exciting. So how do we capture the personal narratives and the individual experiences, moving beyond traditional approaches such as surveying tools and things that are sort of rigid in the way that they operate in social care, because this is what we're all about. For example, we want to create a safe space where people can feel comfortable to share the truth about their trauma pattern or the experiences that they're undertaking. They shouldn't have to turn up at the GP surgery and then at the hospital with two different sets of data records. In learning disability services, for example, they're paper-based quite often. Why can't we have one seamless digitized record? Of course, then we started to talk about shared care and interoperability within the NHS. And there are some accessibility information standards that have been mandated in legislation since 2016. But a third of care providers, when surveyed last year, didn't know that that was a requirement, and a number of NHS Foundation trusts weren't responding to it. So the access to somebody's individual data and preferencing is variable across the country, and that is something that we need to change. So developing the relationship with service users that encourages open commission, better care provision is really something that people were trying to drive towards in our group. We also thought it would have relevance and benefit for some of the things like the Care Quality Commission, in terms of, you would see better care and quality because you'd be engaging with the service directly and having more in-depth sort of narrative type conversations, rather than looking for KPIs or particular data sets which are not focused on independence or quality of life metrics, or things that really help to minimize medication administration or behavioral interventions. So we wanted to think about reimagining some of this narrative around the data with these quantitative metrics as well, and involving lived experience in that. And time was the big blocker in the room. So when do we actually really have the time to come back to think about the data, where it is, and create something that is truly empowering and changing?
Victoria, thank you so much. We have 1 minute left. I'm going to use that as an opportunity to pitch our next event. We will be sending you a follow-up email. If you would like to hear more from the next event, type yes in the chat. We're going to gather all of that up. But we're thinking about sometime in the fall, getting a bunch of people together in a room and trying to answer that question. We're going to create the time to try to answer that question. Thank you very much. to our panelists. That was really wonderful. Thank you for our participants. Thank you very much. And I think that's time. I had more stuff to say. I'll send an email with all the wrap-ups. Thanks for participating and hope to see you in the next one.
Thanks,
Goodbye,
Amy.
everybody.
Thanks all.
Thank
Bye.
you.
Bye.
Very good. I'm just going to end the event. Thank you so much,
Thank you
Victoria.
so much. Will you send us a bit of the transcript of some of their great ideas? Because some of that was so cool. And
Yeah, absolutely. I don't know if I'm going to be able to get the breakout room chats, but I'll try. I'll send you what I'm able
they
to.
didn't. They just talked to me, so that was fine.
Perfect.
Yeah.
Perfect. All right. Well, thank you very much, Victoria. Thanks,
I'll
everybody.
see you soon. Bye.
See you all. Bye bye now.